Hello everybody, this is Dr. Eduardo Beltran. In today's module we will be talking about the stomach and the hydrochloric acid that's made by the stomach and how this has a very big impact on how we digest food. And unfortunately, we also live today in an era where we just have a lot of patients that have digestive issues, and one of the symptoms that usually patients refer to is GERD. And sadly, a lot of us, a lot of practitioners, as soon as we hear the word, epigastric pain, reflux, burning sensation, one of the things that comes to mind is prescribing a proton pump inhibitor, such as omeprazole, cimetidine, or anything that's going to be able to reduce the production of hydrochloric acid. And that's the quick fix that we usually give to our patients when we see them in the consultation room. But today, the title of the presentation is known as the Hydrochloric Acid and Proton Pump Inhibitor Paradox. And I'm going to go ahead and teach you guys and show you why I don't prescribe PPIs to my patients, and when we should be actually looking a little bit more in depth to the root cause of why that patient is not is having excess production of symptoms that might be suggestive of gastritis, when actually it's a lack of it. Okay, so welcome, and let's go ahead and dig in. So as we know, digestion of food has three different phases. Okay, and the first phase starts just with the fact, just looking at food, getting that visual stimuli, smelling food, tasting it. That's actually where it all begins. So the first phase is known as the cephalic phase. So the cephalic phase of digestion occurs before even food enters into your stomach. It's triggered by sight, smell, taste, or just even the thought of food, Then let us not forget that we have sensory receptors in our mouth and brain, and it sends a signal to the hypothalamus. All right. And this is going to send a signal to the brainstem, which eventually is going to stimulate the vagus nerve, right? And in the vagus nerve, this in turn is going to make more saliva, and then we're going to stimulate our stomach in being able to produce, gastric juices such as hydrochloric acid, and also hormones like gastrin. Now, don't forget that saliva contains an enzyme known as amylase that begins the breakdown of carbohydrates, right? And this phase, known as the cephalic phase, we're talking about this first one still, prepares the digestive system for the arrival of food into the stomach and enhances the efficiency of digestion once food is consumed. Okay? All right. Now, the second phase, known as the gastric phase, which is this one right over here, all right, everything that's taking place at this level, the gastric phase begins the digestion when the food enters the stomach. Okay? So there's a distension of the stomach wall by the food, right? That's getting in there. So this stretching of the wall stimulates stretch receptors, and this sends a signal to the brainstem and increases the production of more hydrochloric acid. So here we have more gastric secretion, and which primarily consists of hydrochloric acid. We also make a substance known as pepsinogen, which is later converted into pepsin, and we also make mucus. But don't forget, the stomach has to have a very thick mucin layer that protects it from the hydrochloric acid, right? So hydrochloric acid creates a very acidic environment in the stomach, which is necessary to be able to activate pepsin, necessary for digestion, right? So pepsin breaks down the proteins into smaller peptides, right? And the gastric secretion is also stimulated by a hormone known as gastrin, which is released by the stomach cells in response to the presence of food. Now, this gastric phase continues as long as there's food in the stomach and plays a crucial role in the breaking down of food into semi-liquid mixtures called chyme. All right. And then we have our next phase known as the intestinal phase. Okay, this whole region over here. So the intestinal phase of digestion begins when chyme enters the small intestine. The presence of chyme in the small intestine stimulates the release of hormones such as secretin, cholecystokinin, and gastric inhibitory peptide known also as GIP. Secretin stimulates the pancreas to release bicarbonate, which neutralizes the acidic chyme entering from the stomach. All right. So once we have this food, this chyme is getting into the duodenum, we start making bicarbonate, right, to be able to neutralize that excess acidity that's coming from the stomach. Now, cholecystokinin stimulates our gallbladder, which is right over here. So our gallbladder all of a sudden now starts making contracting because cholecystokinin helps the release of this bile, and this reaches the duodenum, the small intestine, which is going to be helping in the emulsification of fats. So all the fats are going to be emulsified, which is making them more accessible to the digestive enzymes. And we know these digestive enzymes come from the pancreas, right? We also have amylase, protease, elastase. We also have lipase, which are all going to have their specific functions in the digestions of food. So cholecystokinin, also known as CCK, can also stimulate the release of these enzymes for further breakdown of carbohydrates, proteins, and fats, as I just mentioned, right? Now, GIP, right, which is also known as gastric inhibitory peptide, helps regulate the secretion of insulin from the pancreas in response to the presence of glucose. So all of these things are happening in the intestinal phase, as you can see, right? A lot of things are happening all at the same time. And together, these hormones, they regulate the digestive process in the small intestine, promoting the digestion and the absorption of all these nutrients. The intestinal phase is going to continue until most of these nutrients have been absorbed and the remaining waste products moved on into the large intestine, okay? So this basically sums it up for all the three phases that make up part of the phases of digestion, right? Now, what I want to go ahead and talk to you today is about why sometimes when we have, for instance, an individual who has, let's say, epigastric pain, or they might be referring to a little bit of gastroesophageal reflux, right? One of the things that we usually do is prescribe some form of medication that's going to reduce the acidity of the stomach. And that brings some symptom relief sometimes. And usually, one of the medications that is commonly prescribed amongst healthcare providers and physicians is the use of proton pump inhibitors. Okay? Now, these medications, we know they do bring some symptomatic relief, but they have some consequences as well. And one of the things that it does is that they inhibit intrinsic factor. Okay? And we know that intrinsic factor is extremely important for the absorption of a very essential vitamin known as vitamin B12. So this can cause vitamin B12 deficiency, which can eventually down the road end up causing a form of anemia known as megaloblastic anemia. And eventually, if we do not have adequate levels of vitamin B12, we can develop a peripheral neuropathy. So imagine that. Just the fact that you're using this medication just to be able to try to improve your gastric reflux, apparent gastric reflux symptoms, you're actually inducing yourself to a state of vitamin B12 deficiency, megaloblastic anemia, peripheral neuropathy. Now, another thing is that having a low pH by the use of PPIs, you're going to promote dysbiosis. And as we all know, dysbiosis is when we have an overgrowth of bad bacteria over good bacteria, right? And one of the easiest ways to be able to correct this is actually by giving the patient hydrochloric betaine, which is actually a methyl donor as well. Let's not forget that when we have vitamin B12 deficiency, you also affect many other things. You can actually affect cognition. We can also affect energy state, the methylation cycle, the way how our epigenetic expression takes place, because vitamin B12 is an important vitamin for the methylation cycle in order for us to be able to make methyl groups. So vitamin B12 is extremely, extremely important for many, many different things. And usually, we don't take this very seriously because we just think that, it's just a matter of fact of just trying to improve the symptoms of the patient just by giving them a proton pump inhibitor such as omeprazole. So running that back to you real quick, so we know that it induces anemia. It can cause also neurologic symptoms. One of them, the neurologic symptoms can be peripheral neuropathy, which is very characterized by sometimes having tingling, numbness, or a burning sensation in their hands and their feet. It also can cause weakness, difficulty walking. Some patients even might refer that they have some balance issues, memory loss, cognitive decline, and in severe cases, vitamin B12 deficient can even lead to irreversible nerve damage. So that's something that's very important, okay? Mood and cognitive changes can also happen, and it's been described in the medical literature that people who do have vitamin B12 deficiency are very prone to depression and anxiety. And it also they can have issues as brain fog, confusion, difficulty concentrating, and even lead to dementia in severe cases. If you also have vitamin B deficiency, you can experience some gastrointestinal symptoms such as diarrhea, constipation, loss of appetite, and sometimes weight loss. Okay. If you also have vitamin B12 deficiency, you can also end up having a higher risk for cardiovascular disease, including heart disease and even a stroke. And elevated levels of homocysteine is a byproduct of vitamin B12 deficiency. So whenever you check your homocysteine, if you see that's elevated, it might be actually contributed because you have a vitamin B12 deficiency. And that's thought to, increase the risk for damaging your blood vessels and promoting atherosclerosis. Even if now we have vitamin B12 deficiency during pregnancy, well, you have complications for neurotube defects and even affecting the development of that fetus, which can lead to perhaps a preterm birth, a low birth weight, or development delays in the baby. And also, you can also have some bone health issues, and visual changes as well. So vitamin B12 is a very important vitamin, as you guys can see, and this is something that can be caused by the inhibition of the intrinsic factor that these proton pump inhibitors have that characteristic of causing, right? But not only that, one of the things that I just mentioned is that if you have a low hydrochloric acid, this is going to promote dysbiosis, because we know that hydrochloric acid kills all the forms of bacteria, viruses, parasites, and fungus, because it's a form of being able to make sure that none of these microorganisms make their way into the intestine. But if you have low hydrochloric acid being made, this makes you that you're more prone to developing dysbiosis. Right? And this can cause a series of issues down the road, such as metabolic disturbances, autoimmune diseases, and even cancer. Okay? And I'm going to give you an example right over here. So if you have low hydrochloric acid, that's going to lead to a bacterial overgrowth, which eventually will cause an autoimmune disease. And how does this happen is because you can have a form of bacteria, an adherent invasive form of bacteria known as E. coli, which is going to cause inflammation in the gut, an overgrowth in the gut, which can increase the intestinal hyperpermeability, leading to molecular mimicry, and then you end up making antibodies, and this is going to end up developing an autoimmune disease known as Crohn's disease. So this has been described in the medical literature. So Crohn's disease is a form of autoimmune disease, right? Then let's go ahead and talk about bacterial overgrowth that can affect the same bacteria, right? And guess what happens? This invasive E. coli is also known to make a substance known as beta-glucuronidase. Now, when we look at hormones, and estrone is actually not a very good. We do not want to have too much estrone building up in the body, because this can have some negative effects and can cause some issues, as increasing the risk for cancer, increasing the risk for blood clots, coagulation issues as well. And I mean, the list is very long. I can talk about the whole day about the bad effects of estrone when we have too much of it in our body. But here's the thing, our body tries to eliminate the excess amount of estrone through a process known as glucuronidation. Okay, so estrone undergoes a process known as glucuronidation, and it's conjugated with glucuronic acid to form a water-soluble compound known as estrone glucuronide. Now, this conjugation process occurs primarily in the liver and facilitates the excretion of estrone from the body via the urine or the bile. All right? But when we have a bacterial overgrowth, such in this case of E. coli, guess what happens? E. coli makes an enzyme known as beta-glucuronidase, which inhibits the glucuronidation of estrone. So now you have a buildup of estrone that's supposed to be eliminated via urine or bile, but through the enterohepatic circulation, it gets reabsorbed into the organism, into the body, and you start now having a buildup of estrone in the body, thanks to a bacteria that is overgrowing in your gut, making a substance known as beta-glucuronidase. Isn't that interesting? So this causes metabolic hormonal disturbances, you see? And then here's another case. We know that having a low hydrochloric acid environment is going to allow for certain bacteria to be able to survive and start colonizing the gastric lining. And here we know that these bacteria, when they start proliferating, they can cause gastritis. They can end up causing peptic ulcers, and this can also end up becoming gastric cancer. We know that 20% of patients who do not treat their H. pylori can develop at some point in time a gastric cancer. So cancer is something that can also come about from this whole situation. So these are just, things to think about, you know what I mean? Now, here's the thing. This is something I always wanted to tell everybody, because we don't stop to think about this, the symptoms, Sometimes, when you do have some gastric symptoms, or you perhaps might be suffering from what you think you call gastroesophageal reflux disease, it's actually something else. See, what happens is that if we have a low pH, if we have a low production of hydrochloric acid, there are going to be a series of consequences that are going to start to happen. And if the pH is greater than 2, this pyloric valve that we have over here, it's not going to open up. It does not open up. The pH needs to be less than 2 in order for this pyloric valve to open up. And if the pH is still high, all of a sudden now we start getting a buildup of food within the stomach, causes distension, and this can actually increase the pressure at the level of the cardius, which is another valve at the gastroesophageal junction right over here, and you start getting now food going from one acidic environment to an environment where the pH is usually around 6. So if you have a pH of, let's say, 3, and now starts invading the esophagus, you start getting symptoms of, GERD. And the whole reason why this is happening is because the pH, it's just simply above 2. So that should make you think about what's one of the reasons why this is actually happening. So what do we do? So we need to make sure that this patient is on betaine, hydrochloric betaine, because hydrochloric betaine is going to be able to increase the amount of hydrochloric acid, allow for this pylorus valve to open up and help out in the gastric emptying. And then you're going to start seeing that this patient starts improving his symptoms. When do we give betaine? In every meal, 150 milligrams in every single meal. And that should be improving the patient's symptomology, you see? Instead of being able to, start thinking about it. Instead of giving a patient a proton pump inhibitor, we need to be giving them actually something that's going to be helping aid and improve the acidity of that stomach. And one of the ways how you can do that is by giving your patient HCl betaine, right? Don't forget that HCl betaine is also a methyl donor. So this also helps with the methylation cycle as well. Okay, it's something to think about, right? All right, you guys, I hope you guys like this presentation, and I'll see you next time.